This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today, we're looking at a fascinating new study from the journal Clinical Neurology and Neurosurgery, set for publication in 2026, titled Cerebral Venous Thrombosis After Brain Surgery.
This is a topic that hits home for anyone who spends significant time in the OR. We often talk about arterial issues, strokes, or vasospasms, but cerebral venous thrombosis, or CVT, is a different beast entirely, especially when it's a post-operative complication.
Exactly. While CVT has been widely studied in general clinical contexts, like hypercoagulable states or hormonal triggers, this paper specifically addresses its occurrence after brain surgery. The authors point out that it is a rare complication, but one that is increasingly recognized.
And why is that, Alara? Why are we seeing it more now?
According to the review, it's largely due to the frequency of post-surgery imaging studies. We are simply looking at the brain more often and more closely in the immediate post-operative period than we used to. What might have been an undiagnosed subclinical event in the past is now being picked up on routine CT venograms or MRIs.
It's a double-edged sword. Better imaging means better detection, but it also means we have to decide what to do with what we find. The paper mentions that CVT often arises from sinus injury during brain surgery. If you're working near the superior sagittal sinus or the transverse sinus, even a small amount of trauma or retraction can trigger a thrombotic event.
Right, and that leads us to the most significant part of this study, the therapeutic management. The authors conducted a narrative review of the literature published between 2014 and 2025. After screening, they included 32 studies that specifically look at diagnosis and how we treat this in a post-surgical population.
That's a decent number of studies for a rare complication. But let's talk about the controversy the abstract mentions. This is the part that keeps residents and attendings up at night.
You're talking about antithrombotic treatment in the acute phase. The study highlights this as a major point of contention. In a standard CVT case, the gold standard is anticoagulation. But when the patient just had their skull opened and their brain operated on, the stakes change.
Exactly. It's the classic neurosurgical dilemma. On one hand, you have a venous thrombosis that could lead to venous congestion, increased intracranial pressure, or even a venous hemorrhagic infarct. To stop that, you want to thin the blood. On the other hand, you have a fresh surgical site. If you start antithrombotic treatment in the acute phase, you risk a massive post-operative hematoma.
And the paper emphasizes that there is still no clear consensus. Because it's a narrative review of those 32 studies, it shows that while diagnosis is becoming more streamlined through imaging, the therapeutic management remains highly individualized. There isn't a one-size-fits-all protocol yet for how soon you can safely start anticoagulation after the primary surgery.
It really highlights the need for a multidisciplinary approach. For the residents listening, this paper is a reminder that a perfect surgery can still be complicated by the venous side of the circulation. If a patient isn't waking up as expected or has new focal deficits and the arterial imaging is clean, you have to look at the sinuses.
It also reminds us that sinus injury isn't always obvious. Sometimes it's a subtle consequence of the approach or the positioning. The fact that this review spans articles from 2014 all the way to 2025 shows that our understanding is evolving, but the core challenge of balancing clotting risks against bleeding risks remains the central focus.
It's a great summary of where we stand. The rarity of the condition shouldn't lead to complacency. As this paper in Clinical Neurology and Neurosurgery suggests, being aware of the risk factors, specifically sinus injury, and knowing the limits of our current evidence regarding antithrombotic treatment is crucial for any modern neurosurgical team.
Definitely. It's a call for more targeted research so we can move past the controversy and toward more standardized care.
Well said. That's all the time we have for today's deep dive. Thank you for joining us on the Neurosurgery Hub podcast.
See you next time.